Most lymphomas are B-cell lymphomas. That's a type of lymphocytes. But there are subgroups that are T-cell lymphomas, and that can make a difference in how we treat you. In addition, the larger subtype grouping is the so-called diffuse or large cell lymphomas versus the follicular or frequently also of small cells. And those are pathologic diagnoses, and one of the reasons it's very difficult for your doctor and pathologist to have a final diagnosis, they need to determine these type characteristics because it makes a big difference in how you treat. Briefly, the diffuse or large cell lymphomas, which are representative of the more aggressive type, do tend to grow more rapidly, have much more aggressive disease, and therefore need to be treated more aggressively. The large cell lymphomas almost always end up being treated with a combination of chemotherapy. There are a few patients with with stage 1 disease, 1A disease, that do not have any symptoms, have very isolated disease that sometimes can be controlled with radiation. But for the majority of patients with diffuse large cell lymphomas and other aggressive lymphomas, it will be a combination chemotherapy. The backbone chemotherapy for most patients has been a combination of drugs called CHOP, C-H-O-P, abbreviations for 4 different chemotherapy drugs. And frequently with the B-cell lymphomas, in combination that is given an antibody called rituximab. I won't go into details because your doctor will be choosing individualized treatment for you, but that's the standard treatment. The CHOP regimen can be done as an outpatient, usually done about every 3 weeks, and up to 6 or 8 cycles of treatment. Minimum of 6. If your disease is gone after 4 cycles, you stop after 6. If your disease is gone after 6 cycles, you do 2 more and you go to 8 cycles total. In contrast to the large, more aggressive lymphomas, follicular lymphomas can be much more indolent or slow-growing. Depending on the subtype within the indolent lymphomas, you may not need treatment right now. Many of patients can be observed, especially if they're asymptomatic and they have fairly isolated disease or fairly slow-growing disease. Decisions to treat you are based on such things as any symptoms you might have, if you have more rapidly growing disease. Those are indications for treatment. There are subsets that do need to be treated right away, so you and your doctor will work together to figure out whether you need treatment right now. When patients do not need treatment, they're frequently followed with exams, laboratory studies, and usually some kind of scanning to determine the growth pattern of their disease. The frequency of that, once again, is dependent on your particular disease and how it functions over the first few months. Then you can determine how frequently you need to be followed. If and when you do need treatment for a follicular lymphoma, the treatments are sometimes a bit less aggressive than they are for large cell lymphomas, and they may involve just 1 or 2 agents. Sometimes we can use just the rituximab, for example, or rituximab plus 1 or 2 other drugs. So there's a lot more variability among the follicular diseases on how aggressively to treat, when to treat, and stopping points for treatment. The large cell lymphomas tend to be more aggressive, treated more aggressively, and more highly curable, whereas the low-grade lymphomas are more indolent, they don't grow as fast, but they do tend to hang on, and they may go and come. You may treat them and they go away for a while, and then they'll come back and you need more treatment. So they're more of a chronic disease, whereas the large cell lymphomas are much more aggressive acute disease. For all patients, your treatment will be followed by scanning or follow-up, and then possibility of further treatment down the road. There are other treatments down the road if you have aggressive disease, such as bone marrow transplants, but those aren't needed by many of the patients. But if needed, your doctor can work with you on that. If you have an indolent lymphoma, your subsequent treatment may be very similar to your first treatment, and many patients need to be treated multiple times because, as we said, this turns into somewhat of a chronic disease.